Bayelsa State, created in 1996, consists of 8 local government areas and 105 political wards. It sits on one of the world's largest delta and is home to a diverse range of indigenous people in the Niger Delta. Geographical accessibility across most of the 480 documented communities and 1,048 documented settlements are among the most unique features of the state. Bayelsa State is home to homogeneous Ijaw nation with many dialects, and we pride ourselves in how well we seek to advance the development of our communities. The state has over the years demonstrated a focus on progress and collective prosperity.
Health is wealth, and a good healthy populace and system ensures socio-economic development. In Bayelsa State, we are committed to ensuring a healthy system which will develop and encourage a socio-economic development of our people. We have achieved quite a lot in the health system by our transformative system that we put in place. We have not attained all the things that we desire to attain, but we achieved a lot and we are proud about that.
Over the years, the Bayelsa State Health System, led by the Ministry of Health, have implemented a number of innovative strategies to try to improve the health system in the state. And it has been so important to try to unpack these strategies and really understand how these strategies affect people every day.
Under the leadership of His Excellency, the Executive Governor of Bayelsa State, Senator Dayediri, we are ready to improve the healthcare indices of our states. Over the years, we have noticed some level of improvements in our reproductive health, maternal and child health, even the newborn health. By the special grace of God, we have achieved this through a thinking system approach. And by the special grace of God, we are developing a model in which we'll be able to sustain this approach we have achieved over the years.
Some of these achievements can be seen already, and many more will be felt for years to come. One of these remarkable achievements is the establishment of a Bayelsa health insurance scheme as a frontline solution towards eliminating out-of-pocket payment for health services.
Bayelsa Health Insurance Scheme is a social health insurance program created by the government to enable a social security program in achieving universal health coverage. The whole essence of it is to create a social protection system that enables people to go to the hospitals without paying monies at the point of care. We intend to work to sustain the program because it's beneficial to our people. The financial system is strong, and we intend to expand it to every nook and cranny of the state and to involve even the vulnerable who may not be able to pay for those services.
As the state battles to enroll more people in its health insurance scheme and eliminate out-of-pocket payment for health, it is even more important for the state to work to bring services closer to the people, especially people in far-flung communities and in hard-to-reach riverine settlements.
Our Tamangana Health Center don't fall. It don't fall Yakata. No people to treat us. Now only immunization people they come. Nobody they come. Children sick and nobody to take care of them. Now chemist land they go. Sometimes our children not even they survive. Make government come help us.
The Bayelsa State Primary Health Care Board was established to address these exact problems. Despite progress in some areas, the availability of service delivery is still lacking in most part of the states.
The health system in Bayelsa State is trapped with so many challenges, and this is evident in the numbers of pregnant women who are actually attended to by trained birth attendants or trained medical personnel during the time of antenatal care. And it's also evident in the recent numbers of children who are fully immunized for their age. But these challenges are not just relative to the primary healthcare system alone. It cuts across the secondary and tertiary health facilities, where also these challenges are seen in terms of the quality of care being given to those who patronize these services at that level.
The state's journey to fixing primary healthcare is well on track, but we must recognize that this journey must take on a systems thinking approach. One aspect of this system is, of course, the human resources for health component of the system. A health system cannot successfully cater to the people if we do not have the health workers that we need. These health workers also have to be available across the entire state and delivering the services that citizens need.
So Bayelsa State has been quite deliberate in its approach to solving its human resource for health challenges. Now, the state has a College of Medical Science or Health Sciences in the Niger Delta University, and has also, in the not too distant past, established a medical university. Now, Bayelsa State also has a College of Health Technology and has an act for a School of Nursing and Midwifery. Now, what this does is that it positions the state to be able to train and produce its own health workers and can help solve the problem of absolute numbers of health workers over the next decade. Now, when you add that to the fact that the state has also domesticated the Nigeria National Task Shifting and Task Sharing Policy with support from Corona Management Systems and the FP 2020, now FP 2030, what you'd see is that the state is then pulling all of its weight in a bid to maximize the potential of available human resources as well as continue to strengthen its human resources for health. That is quite critical to being able to continue to deliver health services in the state.
Involving the traditional rulers, religious leaders, community leaders and community members in the planning, implementation and monitoring of services, especially at the primary healthcare, can be a game changer. It will help hold health workers accountable and will also strengthen community ownership. This is so important even as government continues to work to mobilize resources to close the infrastructure deficits at the primary healthcare and across all levels. There is a lot of work ahead, but Bayelsa State have shown the capacity to deliver.
The Bayelsa State Diagnosis Center and the State Specialist Hospital in Yenagoa are among some of our other successes in terms of health service delivery infrastructure. Under a private-public partnership, these facilities have become centers for medical tourism, providing state-of-the-art diagnostic services and medical interventions to the people of Bayelsa and beyond. Unfortunately, these facilities are currently facing challenges related to sustainability of service delivery. His Excellency the Governor, Senator Doye Diri, the Executive Governor of Bayelsa State, has resolved to revive these facilities and to ensure all Bayelsans continue to receive high quality and modern health services on a long term.
Bayelsa State has also seen a number of other service delivery successes related to the implementation of Saving 1 Million Lives program for results.
Saving 1 Million Lives, it's a World Bank funded project. It's an international development agency grant to Nigeria to improve the quality of service and the quantity of maternal and child health services. And immunization is one of the priority areas of the intervention of Saving 1 Million Lives, a performance-based initiative and health systems strengthening project. And as such, we have been able to leverage on the funding and the initiative and interventions of the Saving 1 Million Lives to improve on the health system of Bayelsa State, particularly routine immunization.
Clearly, the Bayelsa State health system has experienced many highs and some lows and has learned a lot of lessons on what does not work. The state clearly has a lot to unpack, and one must wonder where the journey will take us from here.
As Bayelsans, we are strong, we are focused. And in this year, we are beginning to fine-tune to improve our healthcare indices. Through the Bayelsa Health Summit with the slogan, Better Health for All. Better Health for All is not just a slogan that we just want to adopt, but by the special grace of God, in every sphere of our development, in our governance in the health sector, we are projecting and professing better health for all Bayelsans and for everyone living in Bayelsans. We are saying better health for every one of you.
So the major goals of the Bayelsa Health Summit is to deepen our understanding of the health system challenges of Bayelsa State, and for we as stakeholders to collectively agree on interventions and solutions that will address these health challenges. We intend to use local data and evidence-based decision-making and strategies to transform the health sector of Bayelsa State. It provides a platform for us to come together, bring international partners, private companies, to rub minds on the challenges of the health sector and look at areas where governments can improve their support and areas where private sector can come in to support the Bayelsa health system. It's our intention that this health summit will look at the strengths, the weaknesses and the opportunities and the threats available in the Bayelsa health sector, and collectively we will forge a way forward for our health system.
His Excellency, by the special grace of God, has directed me, the Honorable Commissioner for Health, to plan for the future of our unborn children here in Bayelsa State. He is posed, by the special grace of God, not to, at any point of his development in this administration, to play politics with the health needs of her people, of everyone living here in Bayelsa State. Thus, the essence of the Bayelsa Health Summit 2021. By the special grace of God, at the end of this summit, we will, as a people, develop a roadmap for the future of the Bayelsans, even the Bayelsans yet unborn. Thank you very much, and God bless you.